Nancy Njeri Rogo. You have to be your biggest cheerleader and advocate, and don't doubt yourself. Chapo is good, but I mean, I have that back home too. So you don't have to just excel academically, right?
Yeah.
You can play sports, you can do dance, you can, do art. All these things are part of the student or the child.
Yo, mambo vipi? Welcome to Mpasho. This is an episode that tuko nayo ya The Big Interview, na leo tutakuwa na bahati ya kuweza kuongea na Miss Kenya USA, who is in Kenya right now. Atakuja kutuambia anafanya nini Kenya right now, manake kuna hiyo title ya USA pale mbele. So we are here to find out a little bit about her, what she's here to do, what projects she's promoting here in Kenya and even in diaspora. So Nancy Njeri.
Yes.
How are you?
I am well. How are you?
Fantastic.
Good.
Welcome to Mpasho.
Thank you.
Yes. So we are here to have a small chat.
Yeah.
Get to know you a little bit, your background. Now that we can see Miss Kenya USA 2024, 2025.
Exactly.
Yes. How are you feeling first?
I'm feeling really good. Really grateful and blessed.
Yes. How has your day been so far?
So far, so good. The sun wasn't there in the beginning, but now it's coming, so the day's warming up. So I'm warming up too. Yes.
Welcome. So
Thank
we just want to find out quickly whether you reside in Kenya, or how do you acquire this title so that the US and the Kenya can mix together?
Yeah, so I was actually born and raised in the States, but then I come from Kenyan descent. So my parents are both Kenyan, so this is that in between. Yeah.
Ah, nice. So how do you
acquire the title?
Yeah.
So you first sign up for the pageant, or rather apply, and then through that application process, they decide whether you're a good enough candidate, and then from there they interview you, and then you're signed up for it.
Yeah.
But I think the qualification is just you need to be Kenyan and living in the States.
Okay.
That's it.
So how often do you come this other side now?
So not as frequent as I would like to, but hopefully I start coming more. So the first time I came was 2011. Then I came November 2024. And then I came now this summertime.
Yeah.
Or not summer for you, but beginning of June, end of May.
Yeah.
Yes.
Oh, okay. We can also vibe with this summer now that you guys are here.
Yes. Sure. Even though Nairobi's weather is not that.
Right now it is complicated because you wake up in the morning, it's too cold, then sun comes out, then it rains again. So a lot of complications.
Yeah. We would say in Georgia the weather is very moody.
Yeah. Yeah, you have been doing a couple of media tours. What are you moving around, and what message are you carrying as you do the media tours?
Yeah, so the whole thing with the tours is first, just letting people know who I am and letting them know the work that I've been doing.
Yes.
So I've been in Kisumu this past month. I was at the Jaramogi Odinga Referral Hospital.
Yeah.
And during my time there, I was with an organization called CHAMPS. What they do is maternal and infant mortality surveillance. So after a child passes away, they go and assess what is the reason as to why the child has died. So that they can inform the local hospital, but as well as inform different people who can do things about it. So that's one thing I was doing, which is part of my master's practicum. And then the other project I'm doing is with an organization called Coalition of International Neonatal Nurses. And what they do is similar to CHAMPS in terms of infant mortality, but they try to preserve the child's life before they pass away.
Yeah.
So we have this initiative in which we're trying to raise 40 cots, bed cots for children to sleep in, and then 10 CPAP machines. Because when you have these children that come out preterm, their lungs haven't fully developed. So they need these respiratory devices to breathe nicely, but the problem is that there's not enough for them. So it puts nurses in a very interesting position where they feel like they have to play God, right? Because it's now you have 10 children and you only have 5 machines. So now you have to decide which child will be able to live and which one will not. But that should never be the health worker's problem. As each parent goes there. They want their child to live, isn't it?
Yes.
And so this is why we're trying to first start off. Our first phase is to have one facility, have the proper equipment. And then from there, hopefully this is just the beginning of making sure that there's good care for each child and that they have a good start to life from the very beginning. And then the third project that I did was with a school called Green Gardens. And so we had the students do career exploration and self-development.
Yes.
Yes.
Ah, nice. Because from where you stand, a lot of people will see you. The title itself, it is Miss Kenya USA.
Right.
But now beyond that, there are things that you are doing that are helping the community. How does this align with now you being the Miss Kenya USA?
Yeah. So each one of us, when we did the pageant, we had a platform, a cause that was near and dear to us. And for me, mine was maternal health primarily and infant mortality. One, because in the States, it's the third leading, like Black women are 3 times more likely to pass away when giving birth. And it's very interesting that it changes from state to state. So like, let's say you look at Louisiana versus Georgia, the 5 reasons why women pass away there is due to mental complications, right? Like mental health complications, versus Georgia may be like cardiovascular or physical. Like, so it's very interesting to see that the outcome is the same, yet the disease is different. So that has to do with care, but also, let's just say, preconceived notions from the caretakers, right? And then, so that's why it was a big thing for me in the States. And then when I looked here in Kenya, I saw it was the 6th leading cause of death. And when you look between male and female, it's the number 5 and 6th leading cause of death, and 6 for both male and female when it comes to preterm children. So it was something that I was like, this is affecting both places I call home. And so it's like, how do I tell people, first off, these statistics exist, but also what are things they can be doing to prevent that? So like here in Kenya, for instance, mothers should be taking folic acid, right? Because that helps the baby fully develop. And then they should also be going to their antenatal care, right? But versus the States, it has nothing to do with the patient, but rather the practitioners.
Oh, okay.
Yeah.
So comparing these 2 places, Kenya and the US, when it comes to healthcare, what are some of the things that we can borrow from the US, because you have been there? Then on this other side, you're trying to establish something that is going to help newborns that are struggling, so far we can say. Yes.
So I think one thing that Kenya can improve within their hospital systems is having some sort of standardization when it comes to care. It's interesting to see, it's like doctors or different healthcare practitioners are strained. So I understand that they have a lot of patients and not enough people. And because of that, you can have someone come in, for instance, I know someone who came in for, let's say, they had a brain aneurysm, but they're being treated for pneumonia. And they're taking pneumonia medicine, yet that's not what they're supposed to be treated. And so if there's a standardization, or you look at the patient and you assess, first off, the symptoms, each patient should be treated based off of what they have versus let's just treat them and then see what happens. So I think that's one thing that I would say Kenya can do a little bit better.
You have been to Kisumu.
Yes.
What will you say? How's the reception there? Because now as you move around, sometimes you try to do something that is new or that is going to improve and sustain or help the community. But sometimes there are opposing forces. There are forces that are supporting for the initiative. How have Kenyans received it? So well. So the good thing with the organization, their champs, the community already really knows the work that they do. And I believe they've seen the outcomes. So when you come back and you say, your child passed away from this, like let's say pneumonia, for instance, then now they go and tell other mothers, like that same mom will say, be careful of this, that, and the third, so that your child doesn't pass away from that. And then people in Kisumu are very friendly, very receptive. So it was even nice. I had the opportunity to go to the Siaya County Hospital. And so even there, people were very, very warm and friendly. Yes. Very nice. So what will be the end goal for this? Or what is the next steps now that you are here during the tour? What do you want to see achieved before you go back to the States maybe?
Yeah, so my goal is to raise 1.5 million Kenyan shillings. So far, I've raised 200,000. But if we reach that goal, that will enable us to get those machines, the 10 respiratory ones, and then also 40 beds for the children. Because the problem is that sometimes there's not enough beds for each child. So then they end up getting an infection in the hospital, yet this is the place they're supposed to be getting healed. Yeah.
Okay. Who are some of the people who are supporting the initiative?
Yeah, so a lot of people in the diaspora, and then also the organization that I listed, Coin, is also supporting, but then also just some people here in Kenya too.
Okay, because it is a good initiative at the end of the day. So if we manage to raise the amount of money you're looking at, then we'll be at a good place.
Very good place.
Yes.
At least for the future, isn't it? The children, we invest in them. That's our future.
Okay. Now, let's talk about a little bit about you now as the Miss Kenya USA. Your upbringing in the US. How can you describe it? Yes.
It was... I will say, growing up in the early 2000s, I'm grateful that we're in the intersection between when technology was coming. So we know how to play without, the phones and iPads. But then also we had like movies and stuff like that. But growing up in the States was really, really nice. I think the only difficulty that came along was when it became a like, who are you and where are you from? And so it was just like, there I am. I'm saying I'm Kenyan. And it made sense my whole life saying I'm Kenyan. Then when I come to Kenya, they're like, where are you from? You're from over there. And I'm just like, okay, y'all, nobody wants me, but not like that. But it's just the beauty of being from two places. Yeah.
So any memories that you can share with us probably growing up in the States? Here, most of the time, there are those childhood games that we used to play. How is it over there?
I mean, I'm trying to think of the games. I know there's like a lot of hide and seek, tag. I feel like games to an extent are universal. Like children will find ways to play in similar ways. There's a lot of pretending to be like, let's say, a chef or like cooking in the kitchen, stuff like this. But I also used to have like online games I used to play. Just a little bit, not too much. Yeah.
Then when it comes to school, how was the education in the US?
It's similar to Kenya in terms of having primary and secondary, but then we have a third one in the middle called middle school. So you go all the way to, let's say, standard 5. Then from 6 to 8, you're in middle school. And then from 9 all the way to 12, or like form 1, 2, 3, 4, that's high school. So it's similar, but I will say in the States, they look at the individual holistically. So you don't have to just excel academically, right? You can play sports, you can do dance, you can, do art. All these things are part of the student or the child versus I feel like here it's harder when they only prioritize test scores for the students. So it's like, how do you do academically exclusively?
Now, where does now modeling enter in this conversation? Because
all
now we have
we
have grown up in the US. We have gone to school. Modeling. Is it in the family?
No. Actually, yes, I have one cousin who would model, but here in Kenya, actually. But I think it was just something with time. The more I grew up, the more taller I got, and people are like, you should model. You should model. I see you on the cover. You should model. So those were things that were always in my head. But, and I did model and I still do model, and I'm looking for brands that align with my values. So then I partner with them. But the thing for me, what differentiates pageantry is that people care what you have to say, right? Like here I am as a beauty queen, not just a model. And I'm here expressing about the platform versus modeling. You're replaceable in terms of just keep quiet, wear the clothes, and take a nice picture. Whereas pageantry, you are your image, you are your brand, and people know you for who you are. So I like how personable it is, and I like how mission-oriented the pageant world allows you to be.
Because everybody, I think, goes on that stage with a mission. You say, if I am able to be crowned, to win this crown, then
this is what I want to do.
Yes. Nice.
Exactly.
So for your mission so far, what are some of the things that you can say you have achieved since you received the crown? That is last year.
So the good thing is that I've gone to several events in the diaspora, so a lot of different states, and met a lot of really cool people. I've been able to raise the funds of 200,000. I had that program the whole month of June at Green Garden School, just empowering students, and then also speaking to students in the diaspora of them knowing who they are as well, just in a different context. Yes.
Oh, okay. Because I read somewhere where you have said that the connections that happen mostly in the diaspora, they should go beyond the service. Just us meeting probably in a concert, then that is it. Yeah.
Exactly.
Why are you pushing that we should go beyond? Know our heritage, know our languages, our culture, and all that.
Because there's power, so much power in knowing who you are.
Yeah.
And I feel like the more people are ceasing to speak their mother tongue, it will cease to exist.
Yeah.
If we keep prioritizing English or French, the colonizers' languages, because then what will we make, or how will we tell our children this is what it means to be this if it doesn't exist anymore? So knowing who you are, or you first have to look at your past to better inform your future. So I'm really, really emphasizing, especially those who don't live here physically in Kenya, to know the struggles that we went through, the history that's there, and the beautiful language and culture that exist.
Yeah. On that note, how good is your local Swahili and even your mother tongue?
Yeah, so Gikuyu I understand, speaking ni gumu, and Swahili I can speak here and there.
Do you know a few words?
And Gikuyu, I do, but I can understand completely. Speaking, that one's interesting.
I want you to say hi to our camera person.
Okay, ohoro ako.
Yeah, because it is very important actually. I agree with you that we should not leave our languages just die like that.
Yeah, and I think it's very surprising to come and speak to many of my cousins or see kids here in Kenya, and a lot of them also cannot speak their mother tongue. And I'm like, hiya, what's happening? I thought like it would be the opposite, but But see, if we don't speak this generation, like if I'm already not speaking and I'm working on it, but if I don't speak and then my kids don't even speak and understand, then just like that, within 2 generations, the language is gone, at least within my lineage, right?
True.
So if we're not mindful of these things, what will be there afterwards?
Yeah. Okay. For us Kenyans who are here, sometimes we look at the US and see like it's a land of opportunities.
Right.
You have lived in the US.
Right.
For you, what will you say when it comes to Kenyans, and let's say generally the African continent, viewing the US as a land of opportunities and all that?
Yeah. So I feel like that, let's see, it is a land of opportunities. And I think the beautiful thing with the States is that initially, especially back in the day, it was a trailblazer in terms of anyone could go there and make anything with their life. And that's true. But it's at the expense of your youth is what I would say. Like people work hard. And I think that's something you don't get, to see much. And having the reality or the mindset that there's problems everywhere, you just have to pick which reality you want, right? In the States, we have our own problems, just the same way here in Kenya, there are problems. But I will even say here in Kenya, there's many opportunities, especially in Nairobi. It's up and coming, and there's a reason why a lot of people are coming back and deciding to invest in Nairobi.
True.
So I think it's just finding where you want to be and positioning yourself there. And there'll always be an opportunity.
True. There will always be an opportunity. So it is just positioning yourself.
Exactly. Exactly.
Okay. So for Kenya, once you're traveling to the US, there's something that we normally say, probably culture shock and all that. But now, when you're coming back home, is there anything that you consider culture shock when you come here?
Yes. The thing that gets me every time is the way people drive. That is the one thing that, even though other things I'm, I guess, more exposed to, like, okay, I've been here several times. The way people drive, everyone keeps saying you have to drive like you're the only sane person. And I said, I'm going to leave that to the professionals. I don't think I could manage to drive here. That's the thing that gets me. No, here in Kenya? No. And I don't plan to anytime soon.
Really?
Yeah, it seems really hard. It seems hard. Yeah.
Okay.
It's kind of like you just go whenever you want to go. Which is good, but different.
It is hectic. Everybody is on the move.
Exactly. Exactly.
True that. So when you come here back at home, what are some of the things that you enjoy doing when you land in this country?
Yeah, visiting family is number one.
Yeah.
It's always a pleasure to spend time with them and be with them. And then another thing I enjoy doing is traveling to different parts of Kenya. So like the coast is nice, the mountain is nice, the lakes are nice, but just enjoying Kenya for all that it is. And sometimes just resting too.
Yeah.
Like the air here is really fresh and just sitting in the sun, and there's a lot of nature. So just like resting compared to the States, you're always on go, 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 go mode. When I come here, it's just like very chill, even though it's Nairobi, but still very chill.
Do you go to the village sometimes when you come here?
I do. I do. I enjoy there too, because then we have like vegetables and food there, coffee, so it's nice.
Okay. Yeah, because we are happy to have you here as you continue to move around, inspire the generation that is to come. So there's some people who look up to you. You're in the limelight right now. There's something that comes, fame sometimes comes at a cost.
Right.
Yeah?
Yes.
So is there anything that you have been forced to do just because you want to get something, or you want to get somewhere because of the fame, or you want to navigate a certain aspect of life?
I think the biggest cost for me has been time.
Yeah.
In order to do certain things like this, it costs me time. So I won't be able to spend this time, let's say, studying or with my family. I've missed out on gatherings my friends would have because during the weekends I'm going certain places. But sometimes you have to see, like you're saying, there's a cost, but is it worth it, right? And I think for me, knowing I had this responsibility of being the title holder, these are the things that came with it. So it's also conditioning my mind instead of viewing it as a negative cost. You know, like when you go buy food, you're happy versus when you have to pay your bill, you're not happy. So I have to tell myself, this is something that I had wanted, and there's going to be certain, I'm not meant to do everything, right? And so just remembering that has been one thing I have to do.
Nice. Social media scrutiny. Now that your name is there, somebody can Google you, can find information about you and all that. Sometimes people overstep. How do you deal with that? Because now sometimes if you're a public figure, then the privacy tends to go away to some extent. I
mean, by the grace of God, I've not had any bad interactions. So everything's been pretty well. I think just minus the typical people will just DM, you know, say nice compliments, but you know, that's it. Nothing too, no negative, no negative.
Okay.
Yes.
Okay. Let me see. There's another one. So here in Kenya and then the US.
Yes.
If you were to meet some of the policy makers that we have in the country, what will be your message to them, and what will you want them to change or work on in terms of generally making life easier from all the aspects of life? Because now for you, majorly it is the aspect of health that you have measured on. But if you get in a room here in Kenya and even in diaspora, with policymakers on something they can work on, and what will it be? I think the interesting thing for me is within politicians or policymakers, many of the times it's as if they're looking for a solution to a problem, and the solution already exists. The only thing is they haven't taken the time to go and connect with the people who put them in power. So I think one of the biggest things that I would advocate for is telling them, go into the communities, sit with a group of people, hear what they have to say, and do something about it. Don't just listen and say, oh, we heard you, but actually follow suit with actions. So that's one of the things that I would say. Another thing is improving the healthcare, of course. As I was saying earlier, a lot of the higher level or national hospitals are like overcrowded. There's not enough people. So finding ways to strengthen the county and sub-county hospitals and even clinical or healthcare clinics so that the doctors at the very top are not feeling that strain, and that people can get the care that improves and saves lives. Okay. So for somebody who is in the diaspora, they have lived there, they are Kenyan, but somehow they feel disconnected to their homeland, heritage and all that. What will be your message to them?
know your roots. The biggest way to know your roots is reading the history, reading the authors such as Goge wa Theongo, those who came before us, who share our people's story in a very different way, and then connect with your family. Like you come from here, and they're just a phone call away. Be intentional, know their birthdays, know the things that they like, and try to make those connections, even though you're separated by miles. Yeah.
Okay. So Sawa, for you, when it comes to your life, do you put your love life in the public, or how do you navigate that aspect of life?
Yeah. So for me, the parts of my life that I share are those relating to like modeling, pageantry, and my initiatives. When it comes to family, love life, and all those other things, I'm a very private person.
So if I asked if you are in a relationship or not, you will not answer that?
That's funny. I mean, I can say I am in one, but that's just as far as we'll go.
Okay.
Yes.
Okay. That's okay.
Yes.
Well understood.
Yes.
So right now, as you continue to navigate Kenya and all that,
yes.
Is there a place, before we come to that, probably you have moved around the world.
Yes.
What are some of the places that you have visited?
Countries. Yes. Okay.
That will have remained in your memory. Say, this was a nice place I visited. Yes.
Number one is Brazil. I stayed there for 6 months. So that has to be up there. I would also say I liked Italy. That was a lot of fun.
Yeah.
And then I also went to Palestine and Israel, and that was eye-opening in many ways. So that's my top 3. Oh, and Mexico. I love Mexico. Yes. I love Mexico, especially Mexico City. Yeah.
Oh, okay. When it comes to travel, what are some of the things that are a must-have in your packing list? You say, I can't miss this and this.
Yeah.
Because now when you're traveling the world, you have to have.
I think for me, I always have my electrolytes because I'm very prone to get, like, it's when it's hot, you're moving a lot. Sometimes you forget to hydrate nicely. So that's one of my non-negotiables. And what else do I have? I think as far as makeup, mascara, as long as the eyes look like they have makeup, then that's fine. And then I always like to have a book as well.
Yeah.
If my phone died, that's fine. As long as I have like a little camera, then we'll just be existing. Yes.
Okay. Which food do you enjoy the most when you come
to Kenya?
Yeah.
Let's see. I enjoy the fish here. It's really good. Yeah. The whole like tilapia is good, as well as, I guess, chapo is good. But I mean, I have that back home too. So I'm trying to think what is something I eat here that I don't have.
That you don't have.
And having the dawa everywhere is really good.
Yeah.
Yeah, the way it's hot and you feel it in your throat is really good.
Yeah.
Yes.
Do you have that back in the US?
Everything we have, you have here, we have there.
Yeah.
In terms of like, my parents are very good cooks. So I've grown up eating everything. And to me, it's the best.
Are you one?
Yes, I am. I am a cook as well. I have to be, of course.
What do you cook best?
I think I like a lot of plant-based dishes. So anything with vegetables, beans. Oh, and I bake really well too.
Okay. The next time we have the battle for camera person, we'll be requesting for a cake from you.
That sounds good. That I can deliver.
So if it is DHL or somebody who will be sending the cake, we will receive it at the airport.
Exactly. Hopefully it'll still be good.
Yeah? We will make sure that it reaches here when it's still fresh.
Sawa.
Yes. So I want us to look at the camera.
Yes.
Then talk to somebody. There are girls who admire the title that you have.
Yeah.
Yes. They want to reach where you have been.
Yeah.
There are people also out there generally who look at you and say, you are an inspiration because of the things you have been doing in the community and all that. I want you to speak to that girl who is always admiring.
Yeah.
Say, one day, I might wear that crown.
Yes. And one day you will wear that crown. Change that mindset and mentality. First, know who you are and place your values in things that don't change. For me, that's God. I place my confidence in God because he's the same yesterday, today, and forevermore. But then also think to yourself, you may not be in this position, but what can you do with what you have? So what are things that you desire to do and dream? If it's here, it's more than possible, but you have to be your biggest cheerleader and advocate, and don't doubt yourself. There's no room for doubt, but you can be anything you genuinely process or believe yourself to be. So go after it and do it. Yes.
Very nice. Thank you so much for speaking to us.
Yes.
Is there anything that we have not touched on that you would like to add on, probably in the conversation?
Yeah, I think we've covered just about everything. Yeah, just that I'm still open to with the fundraising, but also partnering once again with brands that align with my values. So yeah.
Okay. So you're going to be in Kenya for how long?
Just till the end of this week. Yeah.
Okay.
So been here 2 months now. It's time to go back.
Okay.
Yes.
But you are always welcome.
Yes.
And anytime you're in Kenya, always talk to us. We can always do something.
Thank you. Thank you. I will.
Yes. Asante sana. Yes, that is our time on Mpasho. My name is Dennis Milimo, ukipenda mjukuu wa mfalme, and we had who?
Nancy Njeri Rogo.
Who is?
The reigning Miss Kenya USA.
Yes. Thank you so much.
And so you can find me on my website at nancyjerry.com or my Instagram at nn.irungu.
Thank you. Yes, asante sana. We are out.